Mast Cell Activation Syndrome, or MCAS, is a condition in which the body's mast cells release excessive inflammatory chemicals, leading to widespread symptoms affecting multiple organ systems. Imagine waking up every morning with strange symptoms: headaches, unexplained rashes, gut issues, brain fog, only to be told that your tests are normal. Imagine going from doctor to doctor, specialist to specialist, only to hear that your symptoms are all in your head. What if I told you that there's a hidden condition behind the suffering, a condition that affects nearly every organ system, yet remains largely undiagnosed? Hi, I'm Dr. Peter Kahn, board-certified chiropractic neurologist and certified in functional medicine. Let me show you how to master your health. Mast Cell Activation Syndrome, or MCAS, is a disorder where your body's immune system goes haywire, releasing chemicals that trigger widespread inflammation and hypersensitivity. The problem? The conventional medical approach is treating the symptoms, ignoring the root cause. But here's the good news. There are answers. In this video, I'll take you for a deep dive into MCAS, what it is, why it's so difficult to diagnose, and most importantly, how you can take back control of your health with natural, science-backed strategies. Now, mast cells is a type of immune cells, part of your immune system. It's a type of white blood cell. And the mast cells contains a bunch of chemicals inside of it. These are chemical mediators. On a microscope, they look like granules. So mast cells are also one of the granulocytes. And the mast cells, they respond to allergens. Okay, so here we have allergens. And when you have an allergen that come into your sinus or your lung or your gut, you have these specialized dendritic cells. These are specialized white blood cells that has these long arms. Dendrites in Latin means arms, and these dendritic cells with a lot of arms, it's going to grab onto the allergen. It's going to present that allergen to a T helper type 2 cell. T helper cells means a type of immune cell called a T cells. Helper means they're helping the immune system to send out messages to make more baby white blood cells to go fight an allergen or infection. So the T helper 2 type 2 is going to produce all these different kind of chemicals. They're called cytokines. Cytokines are immune messages sent by the immune system to communicate with each other, kind of like text messages sent by the immune cells. And you have interleukin-4, which is a type of cytokine, that's going to stimulate this B cell. This is another type of immune cell that's going to make antibodies. Antibody is how your body remembers the bad guy. So then the next time when you meet the same bad guy, you have some kind of immunity already built up to it. For example, if you get exposed to COVID, you develop COVID antibody. If you get exposed to measles, you develop measles antibody. This is natural immunity. God made it. It's awesome. So B cells, when stimulated by interleukin-4, is going to produce IgE antibody. Now this IgE is a specific type of antibody that are specific for an allergen, for this allergen. And this is going to stimulate the mast cells here to basically make a whole bunch of these IgE receptors on the surface. So it's ready the next time when they see the same allergen, it already recognizes it, it can start to attack it right away. So that immediate response next time when you meet the allergen, it's going to be an acute allergy response. Okay, this is why you can develop these allergy symptoms so quickly, because your body already have met the allergen, you already preloaded, kind of arming the bomb, so to speak, so it's ready to go. That's why you get acute symptoms when you meet that same allergen again. Now you see here the mast cell can produce interleukin-4 that can come back and stimulate the B cells, which then will produce more IgE, which makes this mast cell potentially more aggressive. So that's why people get mast cell activation. This could be a reason. There's a loop here, a vicious cycle. You see that interleukin-4 come from both mast cells and the Th2 cells. They can both stimulate the B cells to make more IgE, which stimulate more mast cell. You can see how this process, if left unchecked, can really cause a lot of problems. Now here, the T helper 2 cells, in addition to stimulating B cells, it can also stimulate this eosinophil. This is another type of white blood cell that are there to deal with allergens and parasites. Now you can actually see eosinophil on your blood test. This is on your standard CBC complete blood count panel. If your doctor done blood work, there's a CBC panel, checks white blood cell, red blood cell. If you've done a CBC with differential, you'll see eosinophil on your blood test. Go back and look at your previous blood test and find this eosinophil number. Now, what happens when it gets stimulated by interleukin-5, then the eosinophil will start to proliferate. You'll make more eosinophils because your body's trying to fight an allergen, right? You need more soldier to fight the allergen. At the same token, mast cells can also produce interleukin-5, so it's coming from two different directions to really stimulate that eosinophil. So when you have allergies, we'll see eosinophil number go up on your CBC blood test. And at the same time, your T helper 2 cells can also stimulate the mast cell directly, not through the B cells by making antibody, but directly stimulate the mast cell to release histamine. This is called a histamine releasing factor. So when your mast cell makes more histamine, that means it's exaggerated response. That's why it's called mast cell activation. The response is normal for somebody else, but for you, it's too much. This is one of the responses that can happen. And then also T helper 2 cell can make different type of neurochemicals that can make neuropeptides that can also all contribute between the eosinophil, mast cells, and these neuropeptides contribute a chronic allergic response. This is where the allergy just doesn't go away. You have it all the time. You always have mucus, you always have stuff going on. Okay, so now I'm showing you this because I want you to appreciate the intricacy of how wonderfully your body is made, but it's checks and balances. There are many things that can overstimulate this. For example, if you're exposed to too much allergen, or you have other things that are stimulating the T helper 2 cells in addition to the allergen, which we'll talk about in this video, then, or imbalance within each of these different areas, then things can get out of control, and that's when you can have an immune system imbalance. Now, the good news is that there's specific lifestyle strategies, nutrition, and supplements that can address different parts of this immune pathway so that we can actually keep things under control and help your body to restore its own balance. Next, we want to talk about the mast cell mediators. These are the granules that we talked about earlier, right? Mast cells degranulate to release these chemical mediators to help you to fight an infection or allergen. Now, the most famous of these mediators is histamine. Most people are familiar with that, right? That's why you take antihistamine to fight allergies. But the reality is that your mast cell make a whole bunch of different chemicals and mediators, and they have different effects on different parts of the body. This is the reason why so many people with these mast cell activation syndromes have symptoms that's overlapping with other conditions and can be very confusing for the doctor to identify it and diagnose it. So let's talk about them. First is the cytokines and chemokines. These cytokines and chemokines, like the interleukin 4 and interleukin 5 that we talked about earlier, has pro and anti-inflammatory effects. So it can start inflammation, but it can also stop the inflammation. So your body's always trying to balance things out, like gas pedal, brake pedal. You need both to drive a car. This is how the body reaches homeostasis. So essentially, it's going to lead to immune regulation. And when this system gets out of balance, you're going to have immune system dysregulation. This is why people get autoimmune disease. This is why people get excessive inflammation. This is why people develop allergies that's out of control. Now, next we have leukotrienes. These are lipid compounds, fatty compounds, that actually contribute to immune function as well, but specifically vascular permeability. What does that mean? That means to make your blood vessel more permeable to let the blood rush in. So you get more swelling, bring blood to the area. Why would we want that? So we can get more white blood cells to the area to fight an allergen or fight an infection. So we're going to have more swelling. We can also have bronchoconstriction. So this is where your bronchioles get more constricted so you can get wheezing and shortness of breath, respiratory symptoms. Next, we have white blood cell recruitment. Now, white blood cell recruitment is to recruit eosinophils and neutrophils. These white blood cells will come to the area again to help you to fight an infection or clear up any kind of allergens. Now, we also have proteases. These proteases are enzymes that help you to break stuff down. Most famous is histamine. We'll talk about histamine a little bit in more detail later. But these proteases contribute to tissue remodeling. Again, help you to break down tissue, break out scar tissue, and also contribute to allergic response as well. Lastly, we have growth factors. And these growth factors, like VEGF, which help with blood vessel formation, and different type of growth factor promote healing response. Now, each of these different type of mediators, different classes of them, and within each class, there's many different kinds, they all do different things. And they can have impact on the different parts of your body differently. And this is why you can have symptoms all over the place. Things really confusing. Let me help you clarify that. So here are the symptoms that can come from mast cell activation, right? From mast cell degranulation. These different chemicals can have different impacts on the body. Now, the most severe symptom is anaphylaxis. This is a severe allergic reaction where you get the bronchoconstriction, you get a severe, a swelling, the airway can be so constricted that you can't breathe, that can be life-threatening. So anaphylactic reaction will be the most severe. Obviously, that's a medical emergency. You'll need to see a medical doctor, emergency treatment, EpiPen, and so forth. So that's not what we're talking about here. We're talking about chronic type of allergic response that has been missed by conventional medical doctor. Maybe you go to the doctor complaining of different symptoms, but they can't diagnose you. They don't know what's wrong with you. They just think you have this, give you a cream. So for example, symptoms of mast cell can include dermatological symptoms, skin. So it can show up as flushing of the skin, redness of the skin, itching skin, rashes, and hives. Okay? And then so if you go to the doctor, you have these skin problems, guess what they give you? Some kind of skin cream. And what is that doing? Treating the symptom, but not the root cause. So maybe the rash gets better, maybe it doesn't, but you never really found out what was triggering it. You may have respiratory symptoms. Now, I'm not talking about anaphylaxis, right, where you can't breathe. We're talking about mucus production. Part of the reason why you have these cytokines and this response is to make a river of mucus so you can rinse the stuff out, the allergen, the dust and pollen that come to your eyes and your respiratory system. You're creating a bunch of mucus to wash the stuff out. So you can have mucus, nasal itch, and congestion in the sinuses. You can wheeze because you can have mucus in your airways, so then that can like rattle and create that wheezing. Or even just the bronchial constriction itself can narrow the airway and create wheezing. You can have shortness of breath. You can have throat itching and throat swelling. Now you can also have gastrointestinal symptoms. These gastrointestinal symptoms can be bloating. You can feel bloated. You can feel GERD-like symptoms, gastroesophageal reflux disease type of symptoms. You can get abdominal pain and cramp. Your GI tract, your intestinal tract can cramp because of these mast cell mediators often can impact smooth muscle contraction. You can get nauseous, even to the point of vomiting. You can have diarrhea. So there can be a lot of GI symptom associated with it. A lot of people experience bloating and they just think like, oh, I just ate something wrong. Or I have small intestinal bacterial overgrowth. What if you have some type of mast cell issue, right? So we have to look at all the different symptoms. We just talked about skin, and then we have respiratory, and then we have gut. It's all over the place, right? You could be going to a skin doctor, a lung doctor, and a GI doctor, and everybody's going to give you a pill to treat a specific symptom, but nobody's putting this together and addressing the root cause of why this mast cell gets even stoked to the point of being out of balance in the first place. Next, we have neurological symptoms. You can get headaches, you can get brain fog, you can get fatigue, you can also have depression, anxiety. These are all symptoms that can come from having too much mast cell degranulation. So a lot of times people with headache, they just pop a Tylenol. What are we really fixing? People often don't know. You need to know what's the root cause, and mast cell could be a root cause. I'm not saying every single headache is caused by mast cell activation, but you need to investigate it, especially if you also have some of these other symptoms. Cardiovascular symptoms. Swelling, right? Blood vessel swelling is a cardiovascular symptom. Angioedema, it's called. You can have low blood pressure. Okay, one of the effects of these mast cell degranulation and histamine is that it can actually cause hypotension. So when you get low blood pressure, then you have no energy because you can't get blood to your tissue, can't get blood to your brain. You don't have enough pressure in your vessel. Then you can cause lightheadedness, dizziness. You can also get unstable blood pressure. There's actually a connection between mast cell activation and POTS, postural orthostatic tachycardia, or even dysautonomia symptoms. So blood pressure can be unstable. Same thing with the heart rate can be unstable, arrhythmia, irregular heartbeat, or even fast heartbeat. You can get chest pain. We talk about dizziness, lightheaded, even to the point of fainting or syncope. You can also bruise easily because you can have bleeding issues where you don't clot because some of these mediators causes more thinning in the blood, so you can bruise easier. Next, we have inflammatory symptoms. You can get a lot of aches and pains in your bone or your muscle. You can even get enlarged lymph node as part of that inflammatory response. And then reproductive. These mast cells and histamine and these mediators have an impact on the female reproductive system where it can cause menstrual cramps and heavy menstrual cycle with heavy bleeding. Lastly, it can even impact on the bone long term, right? This is not like you have an allergic episode today and you get problem with the bone, but if you have it ongoing, chronic, right, long term and not resolved, it can start having impact on the bone, either causing osteosclerosis where you get bone spurs and hardening of the bone in certain places where you don't want them, like in your joints, or you can have osteopenia or osteoporosis due to the inflammatory effect. The inflammation is erosive to the bone. So you can see how we have skin, lung, gut, brain, heart, immune, reproductive bone. I mean, symptoms are all over the place. Like what condition out there can have such diverse impact? Mast cell could be one of those things that's many people are overlooking, many doctors are overlooking, because most of the time these symptoms are treated as separate, compartmentalized individual symptoms needing a different specialty rather than being looked at holistically, which is a process that I take our clients through when we do a comprehensive functional medicine evaluation using the neurometabolic roadmap. So we leave no stone left unturned and identify that there's a pattern here, right? And we're going to talk about how to identify mast cell activation syndrome. MCAS is a complex but manageable condition. By addressing the underlying causes, supporting mast cell stability, and making strategic lifestyle changes, you can regain your health. Now in the next video, I'll show you how mast cell activation syndrome is diagnosed and why the root cause is missed by most doctors. Now if you found this video helpful, please like, subscribe, and hit that notification bell so you don't miss any future releases. Leave a comment in the comment section and let me know if you struggle with unexplained symptoms that may look like mast cell activation syndrome. Thank you for watching. I'll see you in the next video. God bless.